Hello, welcome to ANA community. What do you mean by Doshantara Prakopa or Doshantara Kopa in terms of Sthanika or Agantuja terminology? How to apply these as per the Ayurveda fundamentals and how we can understand the disease manifestation based on the current etiological factors explanation. This will be discussed in this particular video. Dear ANA community, put the like button and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching you the right video at the right time for the right purpose, for your right and the methodical learning. In the previous video, we have discussed Doshakopa. We have discussed Doshantara Kopa. In this particular video, we are going to learn the concept of Doshantara Kopa in terms of Sthanika and Agantuka terminology. The term Sthanika refers to the dosha that is being present in that particular site, whereas Agantuja that is referring to the dosha which is coming from the other side as such. For example, in case of the Amashaya, it is the natural site of Kapha dosha. If the Vata dosha is being entering into this particular Amashaya, this is considered to be Agantuja dosha as such. That is not the Sthanika dosha. In this way, so this is Sthanika and Agantuja that is being explained. In this particular video, we are going to learn this from the point of Nija and Agantuja Vikara. When you think about the Doshantara Kopa description, this is being explained in this previous video in the context of Doshantara Kopa. So that means the abnormal vitiated dosha, that is associated dosha, along with the main dosha. Suppose if the person is having the intake of the ruksha ahara along with little amount of the madhura rasa sevana etc., there may be the possibility of the pradhana dosha vitiation may be vata, but association may be kapha dosha may also be associated during this particular the etiological factor exposure. In this way, the association of the other abnormal vitiation may be observed. That is what we may say that is considered to be doshantara kopa. How to identify the doshantara kopa? Whenever if you are learning about the doshantara kopa, we have to have the thorough knowledge of the relation between the rasa and panchamahabhuta, which is being explained in Ashtanga Hridaya Sutrasthana 10th chapter, Charaka Vimana 1st chapter also. So that is being explained. Kshmam bhog nikshmam bhuteja khvai vajnani lago nilaihi dvayol banehi kramadbhuteh madhuradirasodbhava. So this particular description in terms of the Panchamahabhuta that has to be thoroughly known by an individual. Then the student or learner should have the deep dive understanding of Sharirika Guna. That is the 20 Vimshati Guna they are being explained. Guru Mandemas Nigda Shrashna Sandra Mrudusthiraha Gunaha Sasukshma Vishadaha Vimshatihi Saviparyayaha. Ashtanga Hridaya Sutrasthana 18th chapter. For that, the Hemadri description given the each and every description as per the Ayurveda fundamentals. For example, Yasya Shoshane Shakti Sarukshaha, Yasya Brahmane Shakti Sa Guruhu. So, like that, the each and every Sharirika Guna, its impact on the body that is being explained in that particular chapter. You have to have the thorough understanding of this. Then you need to have the proper knowledge of Bahya Srotas and Abhyantara Srotas. Bahya Srotas, 9 are present in the males: mouth, 2 eyes, 2 nostrils, 2 ears, 1 urethra, and 1 anus. Whereas in case of the females, 3 extra Bahya Srotas are being present: 1 vagina and 2 breasts as such. So in this way, so you have to know about the possible source of the entry in which particular Bahya Srotas is being observed. That has to be known. Along with that, regarding the number of pathogens should be known as such, or otherwise you have to know even about the virulence of the pathogen that has to be analyzed. For example, if the person is going to take one curds itself and he is getting the sneezing itself, in the sense he is very prone to have the respiratory affliction soon. If the person is going to take 3 or 4 cups of the lassi as such and is not getting any of these sneezing etc., definitely he is having very strong physical strength, but the number of pathogens also, they are not causing any of the harm to the patient as such. So like that, you have to know about the source of the entry of the pathogen. That is, in terms of the Bahya Srotas, that has to be known. Along with that, you have to know about even the Abhyantara Srotas affliction also, that has to be known as such. Why so this particular source of the entry of the pathogen, that is important? The reason is more than 95% of the cases visiting the hospitals, the entry of the pathogen that is going to take place through the oral cavity, maybe in the form of the adhyashana, wherein the person is going to consume the food substances before the emptying of the already ingested meal from the stomach into the duodenum. Before that, the person is going to consume it. Normally, whenever if you think about the consumption of food, the food will be remaining in the stomach for a period of 2 hours. If the person is going to consume the food substances before 2 hours itself, then we can say that the person is going to do adhyashana. Then comes the vishamashana. Vishamashana in the sense the pattern of the consumption of food that is very difficult to determine by the clinician, or even that is very difficult to determine by the person who is going to do vishamashana. The term vishamashana refers to abnormal content or quality of the food consumption, which is also varying in different time period. Morning he is going to take very little amount of food. In the noon he is going to take large amount of the food. At night he is going to take the little amount of the food. In terms of the timing also, there is unpredictability. Sometimes the person is going to consume the food substances at around 8 o'clock. Some of the occasions he is going to consume at 6 o'clock in the morning. Some of the occasions he is going to take about the 10 o'clock in the morning. In this way, the Vishamashana, that is the, in terms of the quantity, in terms of the timing, unpredictability as far as the food intake will be identified. Viruddhashana, totally incompatible food substances intake. For example, fish and curds together. Viruddhashana need not be causing the death itself. They are causing the, they are more prone to have the disease frequently. For example, the person is going to consume, they would say that the fish and curds together or fish and milk together, there may be a possibility of a skin disease or any other diseases as such we may suspect. It need not be death only. Samashana, consumption of a wholesome and unwholesome food substances together. That is what we can say samashana. Pathya and apathya bhojana. In the sense, we are going to consume the rice. Along with that, we are going to consume the gadbad ice cream. After that, we are going to consume the gobi Manchurian, etc. So that is Patya and Apatya Bhojana together. That is Samashana. Atyashana. In the sense, at a particular time period, large amount of the food will be consumed up to Akantha Bhojana. So that is up to the throat. The person is going to consume the food substances. For example, during the marriage function. In that particular situation, we are going to expect Atyashana. Tekshna Ahara. Whenever if we are going to the hotels, etc., we are going to do or consume Tekshna Ahara frequently. For example, consumption of samosa or the consumption of the idli sambar, etc., or the consumption of the gobi Manchurian, etc. Guru Ahara, heavily digestible substances. That means the time taken for the digestion of the food will be too long. For example, curds intake, etc. Shitala Ahara, that is ice cream, etc. So like that, more than 95% of the cases, the entry of the pathogen that will be taking place through the oral cavity. So this particular noting about the source of the entry of the pathogen, that is not sufficient. Even we have to know about the nature of the food intake. At what time the person is going to consume the ice cream? At what time the person is going to consume the sweet substances? Is it at the beginning? Or is it after the consumption of the every food substances? Or is it in the middle of the person is going to consume the sweets, etc.? Or whether the person is going to take the water before the consumption of the meals, or during the consumption of the meals, or at the end of the consumption of the meals, etc. So that is the nature of the food intake that will be also be deciding the Doshantara Prakopa. Plus, we have to look into that. After looking at all these aspects, we have to know about the patterns in the diet consumption or in the lifestyle or any kind of the physical or psychological activities. So we have to observe the patterns. For example, lifestyle. When you consider, if the person is the what do you say that the doing the construction work, probably they are going to take the food substances at around 2 o'clock, and after half an hour rest, they are going to do the construction work itself. In that way, so there may be a possibility of the totally a change in the dosha vitiation as such. So like that, whenever if you want to know about the nature of the doshantara kopa, we have to know about these different aspects. If we are able to analyze from these angles, then the identification of the Doshakopa as well as Doshantara Kopa may be very easy. Before learning what do you say that the Sthanika and Agantuja terminology, so though this Sthanika dosha in the sense, the dosha that is being present in that particular place, whereas Agantuja dosha refers to the dosha which is being coming into that particular site. So along with the sthanika dosha, so that is causing the disease manifestation as such. So when you think about this, sthanika dosha in the sense, in case of the skin as such, the sthanika dosha may be considered to be pitta. That too, it is a bhrajaka pitta. If the person is getting the what do you say that the wearing the bangles, etc., and if the person is going to get the what do you say itching, etc., dryness, etc., then we may suspect the Agantuja dosha in that particular situation could be Vata. Sthanika dosha it is Bhrajaka Pitta. So if we are not going into the details of all the other aspects, we are strictly following Sthanika and Agantuja terminology in terms of the Nija and Agantuja Vikara. So we know that Rogasa dosha vaishamyam dosha samyam arogata. Any kind of the imbalance in the proportions of the bioenergies in the body, maybe the vata, pitta or kapha, or maybe the rajas and tamas. abnormalities, they are being considered to be Roga. When you think about it, it's actually a relative terminology. Relative terminology in the sense the person may be who is doing the actual Nidana Sevana or the exposure to the etiological factors. In one individual that may cause the disease, whereas in another individual, same amount of the what do you say that the etiological factor exposure may not be responsible for the disease manifestation. So that's why that is considered to be relativity. That is dosha vaishamya causing the disease. It is always a relativity. So here we can able to apply the principle of relativity told by the what do you say that Albert Einstein. Whenever if you think about the Nija and Agantuja Vikara, so that is Nija refers to the disease which is being caused by the actual dosha vitiation in the body, whereas Agantuja diseases, there will not be what you say that dosha vitiation that will be there, but that is causing the discomfort first. So that is considered to be Agantuja Vikara. Whenever if you think about the disease causing factor exposure, so most of the occasions we are going to look into the what you say that the Bahya Srotas as such. Then the next possibility we are going to think about the Tvak and Asya. So whenever if you think about the disease causing factor, whenever if it is exposed in through the Asya, in the sense the oral cavity, so that will be moving into the esophagus, then that will be moving into the stomach, later small intestine, large intestine. In the sense, so the disease causing factor, when that enters through the mouth, so that will be actually disturbing the physiology of the Agni or disturbing the physiology of the digestive fire. Thereby, that will be responsible for the formation of the ama, that what we can say that is the macromolecules, which in turn, so that will be entering from the alimentary canal into the intravascular compartment of the stomach or small intestine or large intestine. From there, it will be entering into the lymphatic system. From there, it will be entering into the cardiovascular system through superior vena cava. Thereby, from there, it will be entering into the aorta, then to the arteries, arterioles, and capillaries. From there, it will be entering into the interstitial compartment. Later, that will be entering into the tissues as such. In this way, so the dosha nija vikara, so that is usually going to have manifested in the body due to the presence of ama, due to the Agni-mandya, wherein the exposure to the etiological factor will be taking place through the oral cavity only. Whereas the other aspects, whenever you think about the twak as such, in that particular situation, the person will be having the diseases pertaining to the twak, wherein the person may have the clinical symptoms such as the itching, etc. We are going to observe. Of course, it is considered to be the here we are not going to expect the Agni-mandya or Ama as such. It is considered to be a Agantuja Vikara. In this particular occasion, there may be the possibility of the intravascular compartment affliction, interstitial compartment affliction, and intracellular compartment affliction of the Tvak may be observed. Whereas, if you think about the Bahya Srotas other than Asya, from the nostrils, if there is entry of the pathogens are going to take place, the clinical manifestations will be sneezing, running nose, heaviness of the head, postnasal drip, hoarseness of voice, etc. we are going to expect. Whenever the pathogens are entering through the eyes, the person will be having the itching around the eyes, redness of the eyes, burning sensation of the eyes, etc. we can able to observe. From the ears, the person may have pain in the ears, discharge, first discharge may be happening through the ears, or the pain in the mastoid region, etc. we are going to observe. Whenever the pathogens are entering through the urethra, the person may have burning micturition, the person may have hematuria, The person may have pain in the lower abdomen, that is the suprapubic region as such. In this way, the person may have the clinical presentation. If the pathogens are entering through the rectum, the person may have the defecation, difficulty in defecation. The person may have painful defecation. The person may have the bleeding per rectum, etc. We are going to observe. If there is pathogens are entering through the vagina, the lady may be having the pain in the vagina, or there may be a possibility of the pain in the lower abdomen, etc. The lady are going to expect. Breast issues as such, the lady may have the pain in the breast or pus discharge through the breast, etc. We are going to expect. So in a sense, there may be a possibility of affliction of the intravascular compartment or interstitial compartment or intracellular compartment is going to take place in case of the Agantuja Vikara. So when you think about the Nija Vikara, we are going to expect the affliction of the gastrointestinal tract first. Then we are going to expect the affliction of intravascular compartment, interstitial compartment, and intracellular compartment. Whereas in case of the Agantuja Vikara, we are going to expect the omission of a gastrointestinal tract. So that means the gastrointestinal tract will be functioning normally. The discomfort or the disturbances or pathological changes may be observed in the intravascular compartment or interstitial compartment or intracellular compartment in cases of the Agantuja Vikara. So here the same thing we have observed in case of the Sthanika Vikara, in the sense the dosha which is present or the area, for example Amashaya, that's a place of what do you say, that the kapha and pitta. In case of the person who is doing the ruksha bhojana as such, though there will be the kapha and pitta dosha is going to get vitiated as such, but ruksha bhojana, if that is the percentage of ruksha ahara is more, then we are going to expect the vata dosha. So here the vata dosha will be the agantuja dosha in cases of the ruksha ahara. And when you think about the sthanika dosha, in case of the amashaya, that is pitta as well as kapakshaya may be observed, but vata prakopa may be observed in that particular situation. For that, you have to know about the actual nidana as such, what nidana the person is going to consume. Based on that, we can able to decide whether the sthanika dosha prakopa is there or agantuja dosha prakopa is there. We can able to understand. So let us take the one example to understand this particular concept as such. Suppose there are four friends who are visiting the hotel on one day for a celebration. Miss P, Mr. Q, Miss R, and Miss S from left right. So these are the possible, the what do you say, that the descriptions of these four friends. Miss P, she is a pregnant woman. She is a kapha prakriti lady in that particular situation. So there may be the different way of dosha dominance may be observed. Mr. Q is a vata kapha prakriti person and he is a doctor. Of course, there may be a different dosha dominance may be observed in Q. Whereas Miss R, she is the pitta prakriti lady and she is a menstruating lady. In that particular situation, a different dosha dominance may be observed. Mr. S, he is a vata prakriti person and he is a civil engineer. Pitta prakriti woman, she is a pregnant lady. Kapha prakriti lady, vata kapha dominant the individual as a doctor by profession. Pitta prakriti lady, menstruating lady, vata prakriti person who is a civil engineer. So they are celebrating on one particular day for the dinner. So this may be the menu they have ordered. So make sure whenever if you think about large group of the people visiting the hotel for celebration, maybe in the breakfast or lunch or dinner, we are not going to observe same kind of the menu for each and every person. Most of the occasions that will be different menu they will be ordered by the group of the people. So for the celebration as such. When you think about for the easy understanding purpose, I have taken the only one particular example itself. Suppose at the beginning, the people are ordering soup. All the four have ordered the same kind of the soup as let us say. Miss P, she is consuming one full bowl of that particular soup. Mr. Q also consuming the one full bowl itself. Miss R, due to her the physiological variations, she has consumed only half bowl of the soup as such, whereas Mr. S, he has consumed the extra half cup from the Miss R. That means 1.5 full bowl of the soup they have been taken by the Mr. S. In that particular situation, depending upon the nature itself, look into the overall assessment. They are having the different body status. As the four friends have taken the different the quantity of the soup itself, then we are going to expect the different way of the dosha dominance itself. So suppose when you consider the kapha prakriti pregnant lady, so if the lady is consuming this much amount of the soup itself, there may be a possibility of the pitta dosha dominance itself. So whereas the vata kapha prakriti person, there may be a different way of the what you say that the dosha dominance itself. When you think about this, it is considered to be the Tikshna Ushna Guna as such that will be having. Kapha Prakriti person, it may be the Agantuja dosha may be the Pitta, whereas the Sthanika dosha in that particular situation could be Kapha as such. Whereas the Vata Kapha Prakriti person, Mr. Q, that is the Agantuja dosha that may be Pitta itself, whereas the Sthanika dosha may be depending upon the nature itself. It may be either Vata or Kapha itself. So in this way, we can able to apply the Sthanika and Agantuja dosha as such. When you think about the next aspect, the after consuming the soup, they have ordered the tikka, paneer tikka as such. So in that particular situation, the amount may be consumed by all these four friends may be different. Depending upon that, there may be a possibility of the totally different way of the dosha dominance may be observed after the consumption of this. Later, they have ordered aloo paratha. Along with that, they have ordered malai kofta. In that particular situation, depending upon the amount of the consumption of this aloo paratha and malai kofta, different dosha dominance may be observed in the Mahasrotas. After that, some two members have consumed the noodles, whereas the two members have consumed jeera rice. Of course, this may lead to the different way of the dosha dominance may be observed in the Mahasrotas. After that, two members have ordered ice cream and two members have ordered lemon juice. So, depending upon that, dosha dominance may vary. So, to say that the dosha dominance may be observed in all four frames, may be different in different proportions, depending upon the permutations and combinations of the concentrations or percentages of the food consumed, depending upon the nature of the diet intake itself, rapid intake or slower intake, all those aspects that will be counted whenever if you are deciding the dosha dominance, sthanika dosha or agantuja dosha dominance. Dear ANA community, that's all for today. To sum up today's discussion, Doshakopa, Doshantara Kopa analysis is a laborious process which is not usually practiced by the present day Ayurveda learners. We have to start practicing that particular part. When you think about the Sthanika dosha, the term refers to the dosha present in one particular site. For example, in case of the Amashaya, it is the Kapha dosha that is the usually located dosha there. Adho Amashaya, it is the Pitta dosha location. Pakvashaya, it is a Vata dosha location. Whereas Agantuja dosha refers to the visiting dosha to the distant place. For example, if the Kapha dosha is entering into the place of the Pakvashaya, that is considered to be Agantuja dosha as such. But in that particular situation, the Sthanika dosha will be Vata dosha in case of the Pakvashaya. To know the understanding of this, we have to know about the elaborate, deep understanding of Rasa and Pancha Mahabhuta. Kshmambhog Nikshmambuteja Khavaivagnyanilago Nilai Dvayolpane Kramadbhute Mathuradi. This particular concept one has to know. Vimshati Guna, deep dive understanding. Guru Mandehmasnikta Shashnasananda Mrudusthirah Gunah Sukshma Vishadah Vimshati Hisa Viparyaya. Then Bahya Srotas and their impact. 9 Bahya Srotas in males and 3 extra Bahya Srotas in females and their impact when the pathogens are entering through these Bahya Srotas has to be known, and the elaborate understanding of Nija and Agantuja Vikara. What is the pathological changes observed in Nija and Agantuja Vikara? That has to be known very well. In total, whenever if you are observing these, try to observe the patterns in terms of the diet and in terms of the lifestyle, etc. has to be noted, which is very, very important in deciding the Doshakopa and Doshantara Kopa. Whether to decide Sthanika dosha vriddhi or Agantuja dosha vriddhi, etc. that can be decided in an elaborate manner. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below. And spread this particular video to maximum number of true Nidana learners. Don't forget, press the bell icon so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose for better deep understanding of the subject. Thank you.